guys, my name is ChannyMao. I'm a student of RN2 BSN program at Notre Dame College. This is a nursing 200 health assessment across lifespan. Today I will do my head-to-toe assessment on Mrs. Suchiat Long. Miss Suchiat Long, 36 years old. She weighed 145 pounds, 5 feet 3. She's here today for her annually physical exam. And in order to do assessment, I need some materials such as tuning fork for the hearing test, reflex hammer to check reflex, otoscope to check to examine the ear, ophthalmoscope for eye exam, thermometer to check the temperature, pulse oximeter to check oxygen saturation, stethoscope to listen to the lung sound and heart sound, tongue blade to check the mouth and the throat. I have my examination glove, blood pressure cup to check the blood pressure, and my hand sanitizer. So normally we always wash hand before and after examine the patient. So my thing is kind of far, so I'm gonna go wash my hand before I get Mrs. Long to come into exam room. And we always respect patient privacy by close the curtain, but we assume that it's a private privacy room. Uh, I'm gonna go see if Mrs. Long's ready for me. Hi, Miss Long, are you ready?
I am.
Hey, coming in. Nice
Hi.
to meet you.
Nice to meet you.
My name is Channy. I will be your nurse on your physical exam today.
Okay.
How you feel?
Pretty good.
Good. So as we see Mrs. Long walk to the room, her appearance looked appropriate for her age. She dressed nicely. She looks happy. No facial droop. She's smiling at me. Mrs. Long, before we start your head-to-toe assessment today, I will check your vital signs first.
Okay.
Check your blood pressure, check your pulse, check your heart rate, check your respiration, temperature, oxygen saturation. Do you have any pain right now?
No pain.
Good. I'm gonna start to check the blood pressure. Any preference for your arm?
Left arm since it's up.
We put the blood gas cup about 1 to 3 centimeters of the brachial artery. And I will, Miss Long, you mind hold that for me?
Not at all.
I'm gonna pump the blood pressure until it's not palpate apart. And then we increase about 20 to 30 number and release to avoid excessive pressure that can cause bruise, especially if we do on the elderly patient that they have a fragile skin. your blood pressure is 111/70.
Is that a good pressure?
That's a good pressure. It's in the normal range, so the systolic we want uh, below 120 and diastolic below 80. So you're in the normal range.
Good.
Good. The next one, I'm gonna check your temperature. This is a temporal thermometer. So at the same time, when I take her temperature, I also count her respiration. Okay. So I get her temperature 97.9 and also respiration 18 per minute. It's count 1 full minute. So next one, Mrs. Long, I'm gonna check your oxygen saturation. Good. And then at the same time, I will check this radio pulse in counting full minute. I get your heart rate 76, so radio pulse pounding regular, and your oxygen saturation 97% in room air. That's good. So I will check Mrs. Long level conscious. Mrs. Long, would you please tell me again your full name and date of birth?
Sochet Long. Date of birth is July 29th, 1978.
Good, thank you. Can you tell me where you're at right now?
I'm at the doctor's office getting my physical exam.
Good. You know what year we're in?
2015.
What day today?
January 22nd?
June
Oh,
22nd.
I'm sorry, I knew that. June 22nd.
That's okay. We mess up sometime with the breathing. Uh, do, can you tell me about your uh, past medical history?
Not much to tell. Just get migraines from time to time. Not so much anymore. Changed my diet and exercise, so a little bit more healthy, and that's brought the migraine down a lot.
Good. How about your surgical history?
Perforated eardrum on my right side, and I had reconstructive surgery maybe about 10 years ago. Unsuccessful, so it's still perforated.
I'm sorry to hear that. But
Me too.
how about your family history?
My grandmother has hypertension, but she's 92, so
Oh.
still kicking. And then breast cancer on my mom's side, two of my aunts, and not much else on my dad's side.
Okay. So the next test I will check head to toe is
I'll cut it.
So I will start to examine your head.
Okay.
Okay. I'm gonna wear my gloves. Okay. So Mrs. Long have a normal safer leg appropriate to her body. Let's look at her scarf. So scarf, no lesion, intact, no wound, no redness. Miss Long has brown hair, straight. The next one, I'm gonna check your eye. Eyebrow is symmetrical. Check the eyelid. Look at for lesion. Eye, so Mrs. Long eyelid smooth, no lesion. Skin color, it look the same color as the other part of the body. Miss Long, can you clean your teeth for me, do this? Okay. Okay. This, I'm looking for her muscle strength on the face. Good, that's good, thank you. This is, it tell me that Mrs. Long cranial nerve number 5, trigeminal nerve is intact and her facial muscle is strong. So Miss Long, we still do the eye exam, but I would like you to stand. We're gonna do, it's called acuity visual, acuity vision test.
Okay.
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 Okay. So the acuity vision test it have two parts. This one we're gonna do distant vision. The distant vision we're using cylinder chart by placing the chart on the wall and Mrs. Long stand about 20 feet from the chart and Miss Long, I would like you to close your one eye and read the chart from line 1 down to line 8
Okay.
and then see how far you can read.
Okay. Any eye first?
You can close on your right eyes first and
Okay.
read.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C.
Good, good. Do the same on the other eye.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C.
So we have two color over there. Can you tell me?
Green and red?
Good. Okay. Now we're gonna do near vision. So I would like you to hold this paper.
Okay.
It's about 14 inches from your eye
Okay.
and read it for me.
Okay. Complete health assessment and physical exam. Performance checklist. Nursing 200 health assessment across the lifespan. 2014 online.
Good, thank you. So this is normal finding. Mrs. Long can read at the slanted chart 20 feet, and it tells that the normal patient can read 20 feet. And she also able to read without use glasses 14 inches from her eye. That is normal finding. That's good, Miss Long.
Good.
The next one we're going to do, we call peripheral vision.
Okay.
Okay. So peripheral vision, you and me, we're gonna close one eye and then observe the object. I have my pen lights here. So you close your right eye, and then I close this. Okay. So try to look, you know, when you can see my pen light. Can you see it?
Yeah.
Okay.
I can still see it.
Okay. So this is peripheral. That's good. Uh, we're gonna try another eye.
Okay.
So we close that again.
Yes.
Okay. So Mrs. Long, that's good. Mrs. Long and I, we can see the object at the same time. So this finding is normal finding. So Miss Long, I'm gonna look at your conjunctiva. The upper one. Okay. And this eye. Okay. So Mrs. Long conjunctiva is pink, moist and no lesion. And sclera looks white. Cornea transparent, no opacity. It's also this on the left eye is the same. Sclera white, cornea transparent, no opacity. This is I'm gonna do we call cornea light reflex. I'm gonna shine the light. It's about 12 to 15 inches from Mrs. Long and shine the light to no breath. And I will see the cornea light react symmetrically both eyes. Mrs. Long, gonna check your pupil.
Mm-hmm.
Can you look straight to my nose?
Sure.
One more eye. Both Mrs. Long's eye pupil round is about 3 millimeter reactive to light. I'm gonna check accommodation. Mrs. Long, I want you to look and follow my direction. Look far away. Look far away. So I observed that when Mrs. Long looked the object far away, her pupil is dilated. So when the object near close to her, her pupil constricted. It tells me that her eye has a good accommodation. So pupil round, eagle, reactive to light and accommodation. The next one, the next exam, we're gonna use ophthalmoscope exam to look at your optic nerve and retina. So Mrs. Long, I need to darken the light. We're gonna turn the light off. So I'm gonna check on your left eye first. Okay? This is we call a corneal. We're looking for a red reflex. So both Mrs. Long's eye, optic disc is round, gray, and retina red and uniform. This is normal finding. So you have a good eye, Miss Long.
Good.
So the next one I'm gonna examine your ear.
Okay.
Okay. Uh, the top of the pinna and the outer corner of the eye is alignment. Look symmetrical. On the left ear, the outside of the ear looks smooth. No lesion. Skin's intact. See on your right ear. Miss Long, I saw the old scar behind your ear.
Yep, that's the side that
That-
I had surgery on.
Okay.
Do you want me to turn? Turn on the light?
So the next we're gonna do check on your inner ear by using the otoscope. Thank you. So for doll, we're gonna pull the pinna upward and back. Okay. On her left ear, tympanic membrane intact, no perforate. I see a little bit earwax. So we're gonna examine on the right ear. on the right ear, I found that Mrs. Long have perforate on tympanic membrane. That you must have that in the past,
Right.
but it's clean, no earwax.
Good.
The next one we're gonna do, we call the hearing test. So hearing test, I'm gonna do we call a whisper, whisper test.
Okay.
Okay. So I'm gonna stand about 1 to 2 feet, and I'm gonna whisper, and then you, after I whisper, you will tell me, repeat the word that I said.
Okay.
Okay? You ready?
Sure.
Okay.
Streetcar.
And another two words that I say.
Oh, I don't know. I didn't hear that one.
Sorry. You need to close one of your ears.
Oh, okay.
Okay. And then, uh, you ready?
Sure.
Okay.
A
Okay.
and streetcar.
Okay. Do the same. Close on your left ear.
Okay.
Okay. Can you repeat?
I heard a CH and then race car.
Okay.
It's hard to hear on this side.
So the next test we call Weber test. Weber test to see how your both ears can hear equally or not. Okay.
Okay.
So I'm gonna try tuna fork and then place it on the midline of the skull. And you hear which ear hear louder.
This ear, the right ear, a little bit louder.
This is abnormal finding because Mrs. Long have a perforate tympanic membrane, so she hear that on the right ear is louder than the left ear. Normally, should be hear both equally. So the next test we call the Ryan test.
Mm-hmm.
Ryan test, we're looking for air conduction and bone conduction. So I'm gonna strike my tuner fork again and put in front of your ear, and then when it stops here, you tell me.
Okay.
It stop, okay?
Stop.
So this I'm gonna do, strike my tuner fork and put on the mastoid bone behind Miss Long's ear. And then the same thing, when it stops, you tell me.
Stop.
So this is normal finding that the air conduction is greater than bone conduction. Sorry, Miss Long. Normally we ask the patient to change the examination gown, but we don't have an examination gowns. Yeah. I can see her rib both side is sloped down 45 degree. Skin on her anterior thorax smooth, no lesion. I don't see any scar. No redness. Skin color look the same other part of the body. Look at the fingernail. Is the angle of the fingernail is 160 degree. No clubbing nail. Look at one side here. On her right side also fingernail is the angle of the fingernail 160 degree. That is normal finding. Capillary fill less than 3 seconds. Okay. Skin tugger elastic. Skin tuggers elastic on both arms. I'm gonna listen to your long sound.
Okay.
Take a deep breath for me. Deep breath. Again. Anterior long sound is clear to auscultate. Uh, I can hear vascular breakdown from the apex all along, all the way to the base, both sides, and bronchosvascular breakdown you can hear in the middle of the anterior thorax and border of the sternum. Miss Long, I'm gonna check on vocal frequencies. So I want you to say 99, 99, say 99,
99,
99,
99,
again,
99,
again.
99,
Okay.
99.
Okay, thank you. I can feel vibration both sides equally. That is normal finding. The next one, would you mind turn around? I want to check on posterior thorax.
Sure.
Check it the shoulder again. Shoulder bilateral equally and symmetrical. Look at the skin. It's intact, no lesion. Colors the same as the skin color other part of the body. Okay. Gonna listen to posterior thorax. Deep breath for me. Okay. Deep breath. you. I can hear posterior thoracic lung sounds clear, no wheezing, no crackles. Miss Long, we're gonna do again, looking for vocal parameters. So you're gonna say 99, 99.
99,
Okay.
99, 99, 99,
Okay.
99, 99.
Okay. Stop. Thank you. So I can feel vibration both equally. Miss Long, I'm gonna next we're gonna do count the length of the spinal process. We're looking for C7 and count all the way to T12. Okay, C7, T1, T2. You turn a little bit. Thank you. T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. Thank you, Miss Long. So next one, Miss Long, I would like you to lay down on the examination table so I can examine your abdomen.
Okay.
Okay? Sorry, as you can see, we don't really have a examination table, so we use the couch as a table. So I'm gonna be exam Mrs. Long abdomen. So and look at the contour of the abdomen and skin intact, no lesion, no redness. I don't see any umbilical hernia. Gonna listen to Mrs. Long bowel sound. Bowel sound active in fourth quadrant. Gonna be palpate abdomen. Mrs. Long gonna be palpate. Can you tell me is any pain?
No.
No. Any tenderness?
No.
So it's abdomen soft, no tender, no distant. And I palpate here on the right quadrant to see any enlargement of liver, and also on the left upper uh, quadrant to looking if any spleen enlargement, or we call it splenomegaly and hepatomegaly. So I don't feel any liver or the spleen. So this is normal finding. Okay, so the next one, while Mrs. Long laying here, I can look at all her bilateral extremity. See her skin, no lesion, no redness, the tenderness, skin turgor elastic, capillary fill, less than 3 seconds on the toe.
Let me look up. There we go.
Nail bed angle is 160 degree, no clumping. So Miss Long, can I ask you a question?
Sure.
How's your bowel movements? You move bowel every day?
Probably every other day.
Every other day. Any difficulty or urination?
None.
None. That's good. Do you feel any lump, anything on your vagina?
No.
So now we're gonna do neurological assessment. We could do as we go through from head to toe, all the cranial nerves. We already done through the assessment. So I'm gonna start on reflex. So first we're gonna do call tricep reflex. Mrs. Long, can I have your right arm? Tricep reflex by let the patient arm for. I'm sorry, maybe we can turn this way so the teacher can see what I'm doing.
Sure.
Yeah. So I'm gonna bend for 90 degree, use hammer reflex and strike on tricep tender. So this is normal finding that you can see the contraction of tricep muscle. Second one we call the bicep reflex. Bicep reflex, I'm going to put my thumb on the bicep tendon and going to strike with the hammer reflex on my thumb instead of direct to bicep tendon. So this is normal finding. You can see the contraction of the bicep muscle. The next one is a brachioradialis reflex. Brachioradialis reflex, by using the reflex hammer and stroke on about 1 to 2 inches on the brachial tendon about the wrist. So this is normal finding. I can see the pronation of the forearm and flexion of the elbow. We do the same thing on your left arm. So would you mind turn this way so you can see what we're doing here? So we're gonna bend for 90 degrees. So we do tricep reflex again on the left arm. I'm gonna strike the reflex hammer on the tricep tendon. So this is normal finding. If you can see the tricep muscle construction, and we're gonna do again is bicep tendon. So I put my finger on top of the bicep tendon and use the hammer reflex, strike on my thumb instead direct to the bicep tendon. This is also normal finding. I can see the biceps muscle contraction. We do the same on brachioradialis reflex. I will strike on the brachioradialis tendon about the wrist 1 to 2 inches. So this is also normal finding. I can see the pronation of the forearm and the flexion of the elbow. Okay. So this is the reflex. So we're gonna do call the balance cerebellum.
Okay.
Okay. Uh, would you mind stand up?
Sure.
So balance cerebellum, we're looking for the low extremity first. So Mrs. Long, I would like you to put your feet close. Sorry, I think the camera don't see the feet.
No.
Okay. And the discharge. Now, Miss Long, we can do one more reflex. It's called patellar reflex. Uh, I'm gonna strike my reflex hammer underneath of the patellar. Okay. So this is normal finding. Uh, Quadricep muscle contraction that cause extend Mrs. Long's leg. That's a normal finding. So we do the same on your left side. Okay, that's also normal finding that quadricep contraction that cause extend the left leg. Okay, and the next one we're gonna do balance, cerebellum balance.
Okay.
Mrs. Long. So the first one we're gonna do the test. It's called a rumble test.
Okay.
So I would like you to stand, put your feet together, arm relaxed on both sides, and close your eye. This is we're looking for your balance. Okay, this is normal finding. As we see, Mrs. Long can be maintain her balance. The next one we can do heel and toe walk. So I want you to put you're gonna your toe and your heel is tied together when you walk and you maintain and one line straight.
Okay.
You'll be able to do that?
Sure.
Okay. Okay, that's good. So this is the finding normal that Mrs. Long can heel and toe walk and maintain a straight line. The next one we're gonna do. I want you to close your one eye. To close your eye, I'm sorry. To close your eye, and you will stand on one foot,
Okay.
alternate. So
Okay.
to see your balance, if you can maintain at least 5 seconds.
Okay.
Okay. And alternate to the other. Alternate to the other. Yep. Good. Very good. Really good. Okay, that's good. The next one we call hooping. Uh, we want you to close your eye and stand here. Alternate both sides.
Okay.
Okay.
Just alternate.
Alternate. Okay, that's good. And the next one we call deep knee. So you're gonna arm relax and bend.
Okay.
Okay. Good. Good. That's very good. Okay. Next one we're gonna do heel walk. You're gonna walk on your heel.
Okay.
And the next we're gonna do toe walk. You're gonna walk on your toe. Very good. So for the low extremity, uh, she have a good balance, and we're gonna do the coordination coordination of the low extremity by let Mrs. Long gonna be lay on the examination table.
This is fine.
Okay. So this we just looking for the coordination of the low extremity. So Miss Long, can you? I want you to put your right or your left heel and slide down on your shin from the knee, down below to your ankle.
Okay.
Okay. Good. Very good. You can repeat that on your the other leg. Very good. So Mrs. Long have a good coordination on her bilateral extremity. So you can get up now. So we're gonna do the next one is upper balance, upper extremity balance. So I want you to put your palm on your thigh and alternate, back and forth. Okay, that's good. This is the upper extremity balance, and we're gonna check your coordination on your. So I want you to do your thumb touch all the finger, rapidly.
Sure.
Each. Okay. Can you do on the other arm? Okay, so that's good. And next one, I want you to touch my finger and touch your nose. Touch your nose, touch my finger. Good. Very good. Okay, that's good. Sensation and deep sensation. By using the close your eye. You feel it? How that feel like?
Soft, like
Okay.
a Q-tip.
Okay.
That's sharper.
Okay. So this is light and deep sensation that Mrs. Long can feel is a normal finding. The next one we're gonna do kinesia sensation by grabbing one of Mrs. Long finger. Mrs. Long, can you close your eye and then you tell me what I'm doing, okay?
Bending my index finger up.
Okay.
And straightening and bending it down.
Okay, that's good. So this is normal finding that Mrs. Long can tell me what I'm doing. The next one is stay. I'm sorry, it's hard to pronounce that word. Stenogenesis. Stenogenesis sensation. Mrs. Long, can you close your eye?
Sure.
Okay. Can I have your hand? And can you tell me what's that?
A coin. Looks like a quarter.
Okay, that's good. This is correct. So next one we're gonna do 2-point discrimination sensation.
Okay.
I would like you to close your eye again. And then you tell me how many points you can feel.
Am I counting the points? Or
Yeah. Do you feel it?
Yep.
Okay.
Yes.
Yeah. How many?
2.
Points? 2. Okay. That's correct. So get all the reflex done. So the next is gonna be educate your breast exam.
Okay.
Yeah. Normally, especially you have a family history of breast cancer, it's really important to do the breast exam once a month. Normally we do 1 week after your period.
Okay.
But you can do it in the bathroom. Look at the mirror. You will look at your breast, uh, symmetrical, size and shape.
Okay.
Skin. You see the skin smooth. If you see your skin like orange skin, yeah, that is it's not normal.
Okay.
Yeah, your breast skin should be smooth, no lesion, no redness, and also look at your nipple. Yeah, the nipple should be intact, no discharge, no drainage, and you also feel a lump by doing your arm up on your head, and
Okay.
then you can use your two finger kind of slide around your breast. Yeah, yep, you can slide around that.
Like that?
Yeah,
Okay.
and that you feel a lump or mass.
Okay.
Yeah, and then you also at the same time you can check on your axillary
Mhm.
to find the lymph node.
Okay.
So you do the same uh, for both breasts, the same. So
Okay.
check that. And for male, we do the testicle exam. We want the patient to look at their testicle, to look at the skin, to see if both symmetrical or not, and any lesion or any mass. And I think we done our head to toe assessment today, Mrs. Long, and I will document all the finding in the computer, and then Dr. Smith gonna come to see you soon.
Okay. Okay.
And thank you for your time, Mrs. Long.
Thank you.
Okay.
Appreciate it.
I think we're done.